to lead us in the Pledge of Allegiance this morning.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the April 17th, 2017 meeting of the Shawnee County Board of Commissioners. My name is Bob Archer. I currently serve as chair of the commission and represent District 3 alongside Commissioner Shelley Bueller, who represents District 1, and Commissioner Kevin Cook, who represents District 2. Good morning, everyone.
Good morning.
First item of business, please.
Item 1, proclamations, presentations. Number 1, quarterly report on Vallejo. Bill Persinger, CEO.
Thank you, Mr. Chairman. I did distribute the latest narrative on the report to your desk there, and also the first quarter's unaudited financial statement. I apologize, I did not have that document until this morning and would have sent it earlier for review, so I can sure stand for questions following your analysis of that. Before I get started, two very important items of business is to thank the county and the citizens of Shawnee County for the support of mental health. You folks have been very supportive, very tremendous, and it's just awesome. Also want to introduce 3 members of our governing board, unless another one or two snuck in on me, but Mike Wilson and Dick Klein and Frank Henderson, and they are also a font of information should you wish to cross-examine. They've been just outstanding in their support. We go to a lot of legislative meetings together, a lot of community events together, and been at chamber events with Curtis and others, and it's just great to see the board get out and support the mental health center and help us reduce stigma. I might just start, I'll just fly through here if that's okay, and stop me as I go, or I'll stand for questions at your pleasure. So the financial report is not the one we'd like to share, but we have to, of course. Good times are bad. We're still working on our audit for 2016. That'll be done sometime this spring or summer. We'll get that over to the county just as soon as we can. But we are showing a deficit, an unaudited deficit of just over $270,000 for the first 3 months. And to put that in perspective, it's about $60,000 a day to operate the mental health center. So, you know, we did some math, and you know, we'd be about a week behind in terms of revenue. That is of significance. And if, as I'm sure you've already quickly surmised, the problem is in revenue generations from fees, and most of that is going to be from slowdowns that we visited with the county and many others about in Medicaid. And so, in spite of you know, a great effort to provide services and a productive staff and an increased demand, as so is often typical in our business, demand goes up and revenue goes down. Quite a burden of the uninsured in there, and at the same time, fewer Medicaid dollars in the system to support mental health, as it was designed 12, 13 years ago. And so we are struggling every day to overcome the effects of managed care and other kinds of decisions, such as the 4% Medicaid rate cut. We visited with you before about that, I believe, and in a year's time, that will cost us over $500,000. And so if we could simply restore Medicaid rates to what they were, it'd be another $500,000 in the Vallejo budget over, you know, if we go starting back to July 1 of last year. So we're reeling from that. The failure so far to expand Medicaid, we're roughly guessing, if you wouldn't hold me to it, that Medicaid expansion would net between $1 million and $1.5 million new dollars just for Vallejo, and a pretty substantial amount for family service and guidance and other mental health centers and other health care providers in the state of Kansas. And that is yet to come. That would also solve many of our problems in terms of serving the uninsured, because a lot of those people who are now uninsured would have some kind of public health insurance. You can see the effort on the part of the staff there to control expenses, which helped us make it through last year and is helping us so far in the first quarter. So we're getting ready to assemble our internal aggressive think tank again to see where we can change, alter, you know, try to get back on track and end the year in good shape. I Nothing I could stand here and guarantee, though, to you folks or the governing board or the legislature, but we will strive very hard to save every penny that we can. We've got a pretty good track record of that the last 15 months. Just want to comment on our grant writing and fundraising, and for members of the audience, I have extra reports if you want to see that. We've just been going great guns on securing grant funds for the mental health center. Some small, some as small as $500, some in the range of $50,000 for a new van that came out of a charity in Oklahoma. We bought a van here in Shawnee County. It's a special van. Just a number of things we're doing to raise our profile and reduce stigma. Are really enjoying our new Creations of Hope gallery up in Nodo, and I know you folks have visited there and you've seen the activity level, and what a great engagement tool for the community to talk about mental illness in a way that people can understand. And so we think that's doing a lot to reduce stigma, and would invite you to stop by there anytime. I will say on the managed care front that each of the managed care companies is doing some pretty forward thinking in terms of looking at how can the mental health centers achieve certain outcomes with consumers, and then maybe paying us some extra for that. So we're Vallejo and the other mental health centers across the state are engaged or about to be engaged in pilot projects with the managed care companies trying to help psychiatric patients achieve greater health, physical health and mental health as well. We don't think that these pilot projects are going to pay so much that it would alter kind of the course we've been on with reduced Medicaid funds, but it is a step in the right direction. It is an opportunity to demonstrate some, some of the work that we do. Our 24/7 crisis facility, which we're hoping for some new funding there, has been a very busy place. We've gotten a lot of support out of the hospitals and law enforcement and other agencies to keep that aspect going. Cost avoidance studies, there's a couple of them that we've shared and that demonstrate that certain mental health programs can reduce costs in other areas, such as the jail and other kinds of activities in the community. We've talked with Wichita State about doing a cost avoidance study up here, like was conducted in Sedgwick County about a year ago. That would cost about $17,000, and it's money we've decided not to spend right now. We might take one of our programs and conduct a cost avoidance study, our co-responder program, where social workers work on the street with the Topeka Police Department every day and see what cost avoidance we can get there. How many people do we think we kept out of jail? How many people do we think we found shelter for? How many people did we keep out of an emergency room? How many lives did we save? We know we did, but I couldn't stand here today and tell you that exactly. So it would cost some money to dig in and study that, and so we may set aside a few dollars for that since we think that's money well spent. What I am doing is, where I can, grabbing other people's outcome studies. The one out of Wichita, there's one out of Bexar County, Texas, showing a tremendous savings. There was just a study done in Salina at the Mental Health Center. They've instituted some efforts in the jail similar to what we do here, and already showing a cost savings there. So I hope to share those with you over the next few months. 2313, we're sure hopeful that that passes. Would be new money for crisis stabilization centers like we have here in Topeka, Wichita, and Kansas City. And also hopeful that, I didn't put it on here, but I think it's House Bill 2180 would put a privilege tax or a provider fee on certain health insurance companies, and mental health would be slated to get a piece of that. Also, just want to report briefly on our work with JUMP, and I think there's some of our JUMP friends here today. Been discussing employment and housing and how many of these things are connected to mental health and substance abuse, and just had a lot of tremendous support from those folks. Director Cole may wish to comment on discussion we've had about how can we maybe get some employment services into the jail to prepare people to go to work when they get out of jail, could reduce recidivism. And so we've been talking with JUMP with some ideas and have come up with a basic plan there. And then let me just wrap up by saying that we think we had a really successful national accreditation site visit from CARF, the Commission on the Accreditation of Rehab Facilities. They were in our place 3 days last week, and they left with a very glowing report. And so we'll get that final report and share it with you folks in the board. With that, I'll stand for questions or defer to my colleague, Director Cole.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. I want to first say thank you to Bill and all of the Vallejo family of working with our community and our agency. It's been a tremendous and valued relationship that we've had. Just this last year, with your approval, we've had the implementation of our drug and alcohol program, which is tremendous, being able to get a lot of court-ordered, mandated treatment to our inmates. And we also know that drug and alcohol addiction is one of the prime indicators or influences that goes along with a lot of those who find themselves in jail. But yes, we've worked with Bill, and we met with some JUMP officials last week, looking at different programs. We do find, and it's evidence-based at the jail and across the country, that housing and education, or the lack thereof, with our those who find themselves in jail, is a big issue. And so we are working with Vallejo on looking at, with some of their staff, their employment specialists, looking at revamping some reentry initiatives we have, being able to start the process, find out where a lack of or risk are, and then looking at where, like employment, and being able to match them up, meet them with skills, meet with potential vendors, agencies, and merchants in our communities. So we're going to continue to work on that, and but I wanted to give a big shout out to Vallejo, because they do a tremendous job in our community, and they help us with our mission. So, Bill, thank you.
Thanks, Brian. I might add real quickly, folks, that we did determine at the meeting last week with JUMP, one thing we could do right away without a funding increase or much change at all in our staffing pattern is assign one of our supported employment mental health specialists to the jail as a liaison, and maybe kind of jump in there a little bit and start working with some people a little bit more actively, and see what we can produce. Just kind of a little pilot step forward. But we thought with the resources we had at Vallejo, we could alter one person's schedule to get into the jail at certain times, and work with the Director Cole and his staff.
Comments or questions for Bill?
No questions, just thank you again for the update. It's very helpful.
Yeah, Commissioner Cook.
I don't want to take a lot of time. I know it's a complicated question, but what would the Medicaid expansion do? I mean, we talk about $1 million that it would generate or potentially generate, and I know broad numbers, but what would that Medicaid expansion do just for Vallejo? What would we be able to look at?
The first thing it would do would fill that $272,000 gap, and if that's $500,000 by the end of the year, or if it's plus 50,000, it's going to be a tough year. But it would allow us to have some funding to on a fee-for-service basis, using the Medicaid code set that's already in place, and it would be managed by the managed care companies, the way I understand, be to serve people who are uninsured. So right away, our immediate needs are quicker prescribing time. We need professional security in our 24-hour, 7-day-a-week facility, which we did add starting a couple of weeks ago. Started placing professional security TPD officers in our 24/7 facility on the weekends. We don't have the funding to do that, but with the seriousness of the cases that we're seeing, and for example, people waiting to go to the state hospital who stay with us for a day or two or 3 or 5 while they're waiting to go. Folks have lots of needs. Sometimes we assign 2 full-time staff people to work with and supervise one individual for an hour, a half a day, 2 days, and it gets very, very expensive, especially where Medicaid doesn't kick in. Only about half the people staying there have any kind of payer at all, so they're uninsured, and that's quite a burden. So the other thing we are more in need of is people to help third shift and on weekends with our co-responder program, social workers to get out there on the street with the police to do early identification, upstream work with people who need help. But the most immediate needs, Kevin, are in the area of serving the uninsured, how to get paid for work that we already do. A lot of those people have their fees discounted by 90% or more, and county funding and certain state grants have floated that for many years, but the demand is going up so high, and dollars being what they are, they just can't stretch any further. More prescribing and more assistance in our crisis program, not only helping pay for people who are uninsured, but adding prescriptions, doctor time, psychiatric nurse time, in real time in our 24/7 facility, which we don't have now, adding staff and having full-time professional security day in and day out at that facility. We think we can do a lot more to keep people out of the hospital if we can beef up that crisis program. So hopefully there'll be some grant money for that. If there is, anything they can do to expand Medicaid, put our Medicaid rates back, all those things. Those are some of the critical areas at Vallejo right now. So,
Mr. Chairman, if I can just ask one follow-up.
Certainly.
sure.
I know that Director Cole has talked with the commission at length about mental health needs and rising mental health needs at the Department of Corrections.
Yes, sir.
But do you see Vallejo filling more of that gap between the diagnosis of the need for maybe going to Osawatomie State Hospital and the wait time to actually get to Osawatomie State Hospital? Is Vallejo being increasingly relied on to fill that gap?
I think there's more we could do in the jail, irrespective of any other healthcare provider that might be there to add to. We do know that early intervention works well, and one of the things I want to do is keep people out of the director's jail, and I know that we share that goal. So if anything we can do on the street to identify people early who are mentally ill or distressed or homeless and having issues, we want to do that. But I tell you, and the other thing we could do is if we could bill Medicaid while an individual's in jail, that would give us one avenue to at least pay for some of that. And right now, an individual enters jail, it's my understanding that they lose that Medicaid benefit, something we've been trying to change policy on for quite a while. And then, with some additional funding and even I think with tweaking of the personnel we have now, if we can get the people earlier or before their discharge and do some planning, I think we could have an effect. But with that, I'll refer to Brian.
Yeah, Bill, well said. And the tragedy in all this is that this isn't an effort to be soft on crime. I want people to understand that, because there's people with mental illness who do need to come to jail. But the one thing we do know is that we are seeing those who need to go to Osawatomie. They are waiting and they're still in jail. And we still have an obligation to handle. It's not like the mental health or the mental illness goes away until they get to Osawatomie. So we do, and that's what we're working closely with Bill and Vallejo of being able to try to have some continuous care, some programs and things like that to keep them stable, keep them on their medication, keep them safe, keep officers safe until we can get them out of the correctional setting in there. So I do believe that we're seeing, if we can see some increases of revenues and that kind of part, that allows us to continue to build more community relationships and have that inside these correctional facilities and things like that. So
One other area, if I could jump in, Brian or Kevin, is in the area of what's called medically assisted substance abuse treatment detox, medically assisted detox, and that's a pretty expensive proposition, something we've visited with other healthcare providers in the county about for a long time, even before I arrived, and I think that would fill a really serious treatment gap in the community and help some people get off the streets and get into programs even before they commit a crime or come to the attention of the authorities. But certainly, during a jail episode or right after someone needed that level of care, we could get them detoxed. We do quite a bit of detox with social detox, and so we need to apply doctors and nurses in more of an inpatient setting and get that done. And have had quite a few conversations. We're not done with that conversation, but nobody knows where the money's going to come from. Again, put any 2 or 3 or 4 of those things back into play for mental health, which doesn't even make us whole again compared to what's been taken away from us, would be maybe some additional resources to get that done with the savings we found in our expenses. I think the other serious concern in the county is pain management, the abuse of opioids and similar drugs. So about a year ago, we assembled the larger healthcare providers through Vallejo and began to have a community conversation, have a small grant to study that problem. It's a major need in the community, and I know that law enforcement and other agencies see that problem every day. It's kind of a national epidemic to the point that the Surgeon General has made that a top priority. So we know that that's another area of need that I think that kind of drug abuse in the community just puts people in a place where they're vulnerable, and if we can get them out of that vulnerability and prevent problems, I think we can save money right on down the line. So.
Thank you. I just think it's important that we shine a light on some of these state decisions, whether it's a Medicaid expansion, whether it's on the state hospital waiting list, but they do have a direct impact on the county with our taxpayers at the taxpayer level, whether it's Department of Corrections or mental health with Vallejo. And so these statewide decisions have a local impact. and not just isolated.
The water and the pressure has backed uphill quite a bit,
yeah.
and it's taken everybody to pull together, try to deal with that. I do want to say thank you to most of our Shawnee County legislative contingent, very supportive on mental health and substance abuse issues. So.
Thank you
Thank you,
again.
folks.
Thank you. Next item, please.
Item 3, consent agenda.
Comments or questions about the consent?
No questions, I'll move approval.
A second.
Motion made to approve the consent agenda by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed say no. Motion carries 3-0. Next item, please.
Item 4, new business, A County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $404,516.63. The highlights out of that voucher report: Department of Corrections, $172,668.66, of which the bulk of that was from Corizon, our healthcare provider at the jail. Parks and Rec, $65,249.63 as we gear up against spring. It's that time of the year for Parks and Rec. Health insurance, $44,459.77. And finally, holding accounts with the state of Kansas of $25,857.08. Do not have any questions. All my questions have been answered. I would move for approval.
Second.
Motion made to approve the vouchers by Commissioner Cook, seconded by Commissioner Bueller. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item A2, consider correction orders.
I'll move approval.
Second.
Motion made to approve the correction orders by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item B, Parks and Recreation number 1, consider authorization and execution of contract C-132-2017 with the City of Topeka for treatment of noxious weeds with a cost recovery rate of 100%.
Good morning, Commissioners. John Knight, Parks and Recreation. We've had several of these similar type contracts where our weed department treats noxious weeds around the county. This one's with the City of Topeka. It was negotiated by John Boyd, who's our Green Space Director. If you may not know that the weed department works through our Green Space and Land Division, and John's the supervisor of that. So if you have any detailed questions about this contract, he'd be happy to answer them.
I don't. I'll make a motion to approve the contract.
A second.
Motion made to approve by Commissioner Archer, seconded by Commissioner Bueller. All in favor say aye, opposed say no. Motion carries 3-0. Next item, please.
Item B2, consider authorization and execution of contract C-133-2017 with the Greater Topeka Rowing Development Association to allow them to utilize the facilities and Lake Shawnee as the host site for the 2017 Spring Regatta scheduled for April 29, 2017, with a fee of $700 payable to Parks and Recreation and the Shawnee County Parks and Recreation Foundation, along with in-kind services to offset operational expenses.
Good morning, Commissioner. John Knight, Parks and Rec again. This is a special event contract, a special use of Lake Shawnee Park for a special event with the Greater Topeka Rowing Development Association to hold their spring event at the lake. Real similar to many of the other contracts we bring down to you for these special events. Sean Osborne and his staff are really good at getting the notice out early in the year as to any kind of interruptions to the normal schedule of fishing or boating or anything like that, so the public knows those type of things. But if you have any other detailed questions, he's here and can answer them for you.
Questions, Commissioners?
I do not. I would move for approval.
I'll second.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Bueller. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item B3, consider authorization and execution of contract C-134-2017 with the Boys and Girls Club of Topeka for the management of additional youth development program services in a portion of the Velma K. Paris Community Center at a cost of $1,900 per month for the initial term, which continues through December of 2019.
Commissioners, this is a special use of one of our community centers, the Velma Paris Community Center, which is down in the Montera neighborhood. Several years ago, we repurposed the use the Abbott Community Center. Attendance at that community center and participation from all of the kids around the neighborhood and actually across the entire city that use the teen center at the Abbott Center has been a terrific response. One of the things in our master plan that we've talked about many times is really looking at these type of things. Are we capable of running an after-school program? We absolutely are. But the Boys and Girls Club, that they are set up for that. They have sources of funding that we may not have. We still feel we're in the after-school business, but it's not at a county taxpayer's expense. The Boys and Girls Club will be doing this. Clay Neal, who's our after-schools and summer camp supervisor, is here, along with his supervisor, Susan Hensler, if you have any detailed questions.
Thank you. I'll make a motion to approve the Vilma Paris Center is the only community center that's actually in my district, so I'll move to approve the contract.
Second.
I'll second.
Commissioner?
We have just a couple of questions. John, when are we ramping up? When's it going to be open? I mean, we have the Montera area right around there, and so this is going to be a great
We're working in
addition.
a partnership with them now.
Good.
This will solidify that partnership and allow them to do their full program, but right now they're already begun registering kids, those
Good.
type of things. So the big holdup was the National Park Service and
Yeah.
getting back from there, so.
Explain that a little bit, though. Why is that, for people who may not
The
know?
Vilma Paris Community Center, in fact, the entire Shawnee South Community Park that includes Forbes Golf Course is all part of the Federal to Lands legacy program from back in the 1970s. That was when it was still an Air Force base, and when they pulled out, they donated that land. They didn't, that's not a right word, probably isn't, Jonathan. They allowed us to have the use of that land. They maintained ownership of it. We're able to program and have recreation programs on there, but they still control and make sure that it's a public parks and recreation use going on in those. So they supervise all these third-party agreements and all of those type of things as well, too. So.
Good. All right. Yeah.
Yeah, thank you for
Completely
bringing that
support
up.
that. Yep.
Anything else? Motion made to approve by Commissioner Archer, seconded by Commissioner Bueller. All in favor say aye, opposed say no. Motion carries 3-0. Next item, please.
Item B4, consider authorization and execution of contract C-135-2017 with Kona for concession sales for the aquatic facilities and special events at a cost of 20% gross sales minus applicable taxes to the building maintenance fund.
Commissioners, as I was talking with Betty Greiner about this is kind of a pilot program that we're trying to get started. It's a group that'll come in, and it's not going to take over all of our concessions, but they'll sell in some of our places, share the revenues with us. We'll see how it kind of goes this year before we extend it, but they'll be at several of our locations this year, and if the more popular they are, probably the more you'll see them around our community with special events and those type of things. Dave Aliker is the guy who is behind this, made all of the arrangements with them and negotiated this pilot program, and with that, either him or I can answer any detailed questions you may have.
So if something goes wrong, blame David? Is that what you're saying, John?
That's exactly, yes. Want me to start rewording those statements at the end of my things, I'll be glad to do that.
Okay, thank you, John. Any questions on this agreement?
I'll move approval.
Second.
Motion made to approve by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 3-0. Thank you, John. Next item.
Thank you, Commissioner.
Item C, Public Works Solid Waste, number 1, consider authorization and execution of contract C-136-2017 with Bartlett West for construction engineering services for the Main Sewer District number 2, lateral number 4, in Timber Ridge subdivision project at a cost of $11,200 with costs paid by Dultmeyer Homes.
Good morning, Commissioners. Tom Block with Public Works and Solid Waste. This is a Public Works item. In this particular project, this is the next phase of the Timber Ridge subdivision in which Dultmeyer Homes has been developing and constructing the lots and building many of the homes. On these types of projects, the developers work through the county to help administer the contracts with their consultants. So Dultmeyer Homes chooses the consultant, and then the county then, since it's in the county, helps administer it. So what's happened in this case, Dultmeyer Homes has provided the $11,200 to us already, and we put it into account, and then the county actually enters into the agreement with the engineering firm, and then we will end up then paying those costs as they come in for a full-time inspection. So this is typically, this is a typical process for this type of project. And we have met with Doltmeyer Homes and their consultant, and as I mentioned, Doltmeyer Homes has already paid us $11,200, so it's our recommendation that this be approved. Any questions? I'd be happy to try to answer them.
And why does Chuck just not negotiate with Bartlett and West? And I'm not sure I understand what our role is in this.
When on this particular project, if a developer is wanting to set up a benefit district, oftentimes they'll, in this particular case, Doltmeyer Homes usually cash fund one portion of the project, like streets, and then they get a benefit district on the other portion.
Okay.
Whenever they do a benefit district, they get, basically they finance it through the county, and then so the county is involved in that respect, and then assessments are put on each lot that are administered by the county. So we get ourselves tied into these projects through that manner. So as such, then the county helps administer it on behalf of the developer and their consultant, just to make sure that it's meeting the county's design standards and things of that nature, and that it's built accordingly to our design standards. So that gives us that avenue to do that. So as such, we get involved in the process of their contracts, I guess, with their developers, I mean, with their consultants. So I guess that's why we're kind of tied into it.
Okay, no, that makes good sense. When I went over it, I didn't realize what role we played. But bottom line is we've got new housing coming online and the economic development that goes along with that.
Right, and the developer is paying for all of it, so.
Yeah, absolutely. Okay, other questions?
I'll move to approve.
Second.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. Opposed, no. Motion carries 3-0. Thank you
you.
very much, Tom. Next item.
Item D, Emergency Management, number 1, consider approval of resolution number 2017-16, adopting policies and procedures for first responder grant funding.
Morning, Commissioners. Nelson Castile, Ambulance Compliance. This is part of the benefits that we gain from the new contract between Shawnee County and AMR. We're gradually getting all the parts moving now that the contract went in effect on January 1st. This will take the fine and penalty monies paid by AMR. It goes into a special revenue fund, and then those would be dispersed out. Because it comes into Shawnee County, we have to have a manner by which those monies are given, some criteria, some qualifications or parameters there. We just can't hand them money based on that they're a first responder agency.
Very good. Questions or comments for Nelson? I'll move to adopt the resolution.
I'll second.
Motion made to approve by Commissioner Archer, seconded by Commissioner Bueller. All in favor say aye. Opposed, no. Motion carries 3-0. Thank you very much, Nelson.
Thank you, Commissioner.
Next item, please.
Item 5, Administrative Communications.
All right.
Short trip. Nelson Castile Emergency Management, they wanted me to announce that tonight at 7 p.m. Washburn University Memorial Union will be the National Weather Service Spotter Talks. They'll be probably about 90 minutes. It's the talk that we normally would have in March, but due to the severe weather and tornado warnings that we had during the March 6th evening, it was postponed until tonight. So 7 o'clock at Washburn Memorial Union.
Thank you.
Thank you.
Thank you. I know we've got representatives from the chamber here, and there's a lot going on in our community regarding jobs and economic development. So Curtis and Jackie,
Morning.
it's all yours.
Good morning, Commissioners. Curtis Sneeden, Greater Topeka Chamber of Commerce. If you've been paying any attention to the media over certainly this weekend and the last couple of weeks, you will not have missed the dialogue publicly that's been taking place relative to the disposition of St. Francis Hospital. I would like to draw out a couple of points relative to that. The first one is that it is apparent that our community clearly and understandably is very concerned about some of the things we're hearing about St. Francis and its future. To date, there are virtually no new facts that instruct our thinking on what's happening over at St. Francis. And so we think it's important to stay focused on facts and watch as those become available. The other thing I wanted to draw out was a note that Commissioner Cook made a second ago. This isn't a political issue. We're not in any great hurry to politicize this matter. Certainly from the standpoint of the staff at St. Francis and the patients they serve, this isn't political. The uncertainty they face is a very real kind of bread and butter question. It isn't an ideological abstraction. Nevertheless, as the Commissioner pointed out, the decisions that are being made at a higher level of government over at the State House have a real effect on our communities and institutions like St. Francis. The Chamber of Commerce has been a big advocate for Medicaid expansion. We are very pleased with those members of our delegation who voted to try to expand Medicaid. And if nothing else, even though we don't know what the future holds here, this open dialogue will hopefully help signal to those higher level decision makers the importance of the policy decisions they're making, and maybe give them a clear opportunity to visit that topic again. Now with that, I'll turn it over to Jackie, who will give you a little more detail on our specific response.
So what I just want to address and keep you guys apprised of what Go Topeka and the Chamber is doing. So obviously this has been a discussion in our community since the time that St. Francis announced that they were going to sell. Obviously, here recently, there's been a much stronger dialogue on that, and so we have been in communications with many of our partners. So you might not see that publicly, but there are a lot of discussions occurring behind the scenes of looking at what may happen in the future and what impact does that have on our community, both economically as well as from a healthcare access standpoint. And so we are having many conversations with our partners and trying to prepare our community for what may potentially happen in the future and how we can best move forward and be resilient and make Topeka the best that it can be. So we'd be happy to answer any questions that you guys may have in terms of our efforts, but just know that this is something that we're definitely working on and having a lot of conversations.
Questions for Curtis or Jackie?
Thank you very much.
Okay. Thank you for coming this morning.
Absolutely.
Appreciate it. Others for administrative communications?
Good morning, Brian Cole, Shawnee County Department of Corrections. I think if anybody's paid attention to the news, that they've heard of an officer who was severely injured while on duty. As a director and spending time with this officer at the hospital, it's one of your worst things that you can do is having to go to the hospital or get the call. I do want to say that this officer has been very tough. It was in tremendous spirits. Unlike me, who probably would have been still bawling, she was in the hospital room, tremendously doing very well. And I want to first give a tremendous shout out to the staff who were there and the peer support that she's received from the staff. And often, Commissioner Archer has mentioned, when the jail stays out of the media, things typically are pretty good. And as much as we try to do stuff, when you work in the jail, you do find yourself working in an environment that is closed off to the community. But this staff here do a job that few will like to do. But she's doing very well. I don't want to go into a lot of detail because we have referred this to the Shawnee County Sheriff's Office, and I do want to say thank you to Sheriff Herman Jones and that staff there that's been tremendously supportive. All of the law enforcement community has reached out to me and our staff during this time, and I've reached out to the district attorney. So with that, I don't want to ruin any of the integrity of this investigation or anything like that, other than to say that this officer and the staff are doing very well, and we were going to continue to wrap our hands and arms around our staff to make sure they understand that we do care and that we're going to do our best. And I appreciate the support the commissioners gave me when I let them know that this happened, and so thank you.
Thank you, Brian. Others? Commissioner Cook.
Just our thoughts and prayers to our Department of Correction employees and our staff member and hope for a quick recovery.
Absolutely. Commissioner Bueller?
The same. And I know, Commissioner Archer, you have probably a heavy topic, the state of the community on Thursday. That speech with the mayor is happening, right?
Is that this Thursday?
This Thursday, I think so. So, wish you all the best with that.
I look forward to that, actually. We ought to, we'll have a lot of fun on
Well,
Thursday.
and despite all the challenges we have going on in this community, I mean, we are doing a lot of good things right. So that's what we have to keep focusing on and continuing to work hard together. That's the only way we're going to get through it. So.
That's true.
Yeah.
And now that you brought it up, to give you a preview, Thursday I'm going to talk about the strengths we have in Shawnee County, some of the major challenges we have, but some of the core values that we rely on to get us through the challenges that we do face. So thank you, Commissioner, for bringing that up. I don't have anything else to add. So next item, please.
Item 6, executive session.
There's not a need, so we are officially adjourned.